It is Wednesday, March 27th, 2024. And I wanted to share with you all a dream I had last night where I was in a townhouse that I've been in before in dreams. And I've decided it's either a military housing complex or a housing project that had formerly been or had previously been a military housing complex, which is very common. And it's like a townhouse set up with a rectangular front room, and then there's a wall that will allow you to go into the unit on either side. So both sides, it's like just a wall in the center of the room, and then on the other side is the kitchen, and then like a breakfast bar setup where there's the sink, and then on the opposite side is where you could put some stools, and then behind that is space for like a dining table. And in this particular dream, there were several young mothers. One who was of Asian was of Asian descent and was pregnant, and then there were a couple of other mothers who had young children, and one had an infant. And these women had absolutely no idea how to take care of their babies. And one of the mothers was actually trying to pour milk into the baby's mouth. So I immediately stepped in and started supporting them and explaining to them, nutrition and how to comfort the baby when the baby's crying, and how to tell if the baby's hungry versus needing a diaper change, or just is uncomfortable. And so when I woke up, I immediately started pulling some things together which I'll show you here in the community. And this particular video is actually about World War II, I believe, soldiers, black soldiers in the British UK who were encouraged to be entertained by Caucasian British women. And the result of that became a lot of biracial children. And I wanted this cover photo to be shocking to help men to appreciate, or to somehow have their emotions triggered, that you need to be protecting infants and children, not being baby factories. And so I did share some videos from COSMED, and you can go on YouTube to their channel and see all of the different equipment and things that they manufacture for doctors and scientists who want to do Frankenstein level experimentation on even infants. And ask people to consider how not being able to access a qualified elder, preferably your own mother and father or grandmother and grandfather, will contribute to problems in understanding how to properly care for your children. And these two videos I did a couple of months ago when I was very focused on foster care kids and why they are so medicated, which is another aspect of what I consider legalized kidnapping. So this legislation I have shared in another video, but I did not talk about it. So I wanted to walk through it with you to help you understand how legislation is crafted in order to meet an agenda. And this is actually from the, I think, 2022 legislative session. And the first one is healthcare data reports, carriers. And then it says that this particular bill would direct the Department of Health through its contract with the nonprofit organization, which is not named, that compiles and evaluates healthcare data on behalf of the Commonwealth and in consultation with the Bureau of Insurance of the State Corporation Commission. And then they are to develop and implement a dental, vision, and healthcare methodology to review and measure the efficiency of those particular services. Then this one says it's for hospitals, and it directs the readmission of certain postpartum patients, directs the Department of Public Health to develop protocols for OB hospitals. And then this one is for foster care, which makes a provision for housing support for persons between 18 or 21 who would normally have aged out of care and be either homeless or they're independent. They will receive no additional support from the Department of Human Services. Then this one, the Shipping and Logistics Headquarters Grants Program, to reflect changes in agreement between the Commonwealth and a qualified company for shipping and logistics. Then grounds for divorce, cruelty, abuse, desertion, or abandonment eliminates the 1 year waiting period for being decreed a divorce, meaning there's no waiting period. If you just say he beat me or she deserted me or abandoned me, then you can go ahead and get the divorce. So that's creating single parenthood. And then Fostering Futures is a program that was implemented in the city of Norfolk, which addresses this group right here, because they are no longer being housed in foster care homes or group homes. They are given housing, but they still have to follow guidelines given to them by the Department of Public Health and their social worker, which includes, having a job or being in school and things like that, which also contribute to their workforce agenda. But what I want you to understand is when you look at all of these things together in context, this is legalized kidnapping, because if you are directing hospitals who rely on insurance for their finance to admit certain postpartum patients, then you set up a scenario where a mother of a young infant can be deemed incapable of properly caring for her child, and thus bringing them into care, quote unquote, temporarily. But then ultimately, based on the rest of the legislation, could possibly have her parental rights terminated. And I specify her because in foster care and really in housing, subsidized housing, you cannot have a man living in the home. It's a condition of receiving the benefits. You can't have a man in the home, because supposedly the thinking is that if there's a man in the home, he should be supporting the household, which is true. But we don't live in a free will society. We live in a militarized global condition. So I wanted to show that to you to help you to better understand how to look at this question about what it is you want to have in your home to feel safe, healthy, and happy. And then once you have that wish list, that grand wish list with no restrictions, ask yourself, well, why can't we have that? Or why doesn't that exist? Or why can't we access that? Or why do we have problems with doing that, or whatever have you? Because the barriers to having those things have nothing to do with your capacity or even your willingness and receptivity to have those things in your home or have those rules in place in your home. It's usually something external, because the God that is trusted with the monetary system is very, very clingy, codependent, and controlling, and wants you to be completely dependent upon the government, but then doesn't want to help you to be able to sustain yourself or be independent. Definitely not interdependent, but they really do not want you to be independent. Otherwise, they would have a more difficult time maintaining this system. So I hope that is useful and that you all will take another look at this. This is why I have been such an advocate for getting kids out of foster care and not having them go into care, and trying to be preventative about that. And why I work with young mothers, specifically women who were considered at risk for postpartum depression, so on and so forth, so that we could work through those things before the government had an opportunity to step in and intervene. Thanks for listening.